Medications are crucial in modern healthcare, helping manage everything from minor ailments to life-threatening conditions. They often provide relief and improve the quality of life. However, the long-term use of certain medications can come with risks that aren't always part of everyday conversations. Interestingly, many doctors are cautious about taking some of these medications over extended periods, even though they regularly prescribe them to patients. The concern lies not in the effectiveness of these medications but in the potential side effects and complications that arise from prolonged use. So, have you ever wondered which medications doctors might avoid for the long haul? This isn't to say that medications are bad. On the contrary, they are often essential. But being informed about the potential downsides allows for better decision-making regarding your health. In many cases, doctors prefer exploring alternative methods like lifestyle changes, natural remedies, or safer medications that could reduce the need for long-term use. These alternatives not only help manage conditions but can also decrease reliance on medications, offering a more holistic approach to health. One reason doctors avoid long-term medication use is the gradual onset of side effects. For instance, painkillers can damage kidneys or the digestive system with prolonged use. Similarly, long-term use of corticosteroids, prescribed for inflammation and autoimmune diseases, can lead to bone loss, high blood pressure, or infections. Medications like proton pump inhibitors, PPIs, used to treat acid reflux, are linked to nutrient deficiencies and kidney problems when used for extended periods. Doctors, who understand these risks, may opt for preventive measures like diet, exercise, or non-pharmaceutical alternatives to maintain their health without over-relying on medications. In the end, medications aren't inherently harmful, but understanding the potential risks of prolonged use is key to making informed health choices. By working closely with healthcare providers and exploring alternative treatments, it's possible to manage health conditions without relying too heavily on long-term medications. Let's take a closer look at the 5 commonly prescribed medications that many doctors prefer to avoid for extended periods, and why. Medication 1: Non-steroidal anti-inflammatory drugs, NSAIDs. First on our list are non-steroidal anti-inflammatory drugs, or NSAIDs. These medications, including popular options like ibuprofen, Advil or Motrin, aspirin, and naproxen, Aleve, are widely used to relieve pain, reduce inflammation, and lower fevers. They are often the first choice for common issues like headaches, muscle aches, and arthritis because they provide effective and quick relief. However, while their over-the-counter availability makes them easy to access, the long-term use of NSAIDs raises significant concerns that many healthcare professionals take seriously. While NSAIDs can be safe and effective for short-term use, their potential long-term risks cannot be overlooked. One of the most concerning effects is their impact on the stomach lining. NSAIDs work by inhibiting cyclooxygenase, COX, an enzyme crucial for producing protective chemicals in the stomach. When taken over an extended period, this inhibition can weaken the stomach's defenses against acidic digestive fluids, increasing the likelihood of developing stomach ulcers and gastrointestinal bleeding. Such conditions can escalate into serious complications, including perforations of the stomach or intestines, which often require surgical intervention. Therefore, doctors often express caution when prescribing NSAIDs for chronic conditions, knowing the severe repercussions prolonged use may cause. The risks associated with NSAIDs extend beyond gastrointestinal issues. Long-term use is also linked to cardiovascular complications. Research indicates that regular, high-dose NSAID use can significantly elevate the risk of heart attacks and strokes, particularly in individuals with pre-existing heart conditions. Additionally, these medications can adversely affect kidney function by limiting blood flow to the kidneys, potentially leading to chronic kidney disease, CKD. Given these risks, many doctors recommend alternative approaches to managing chronic pain. While acetaminophen, Tylenol, may be a safer option for long-term pain relief, it's essential to note that it, too, has limitations, especially for those with liver issues. Beyond medication, lifestyle changes can be instrumental in managing pain without the long-term risks associated with NSAIDs. Regular exercise can improve overall health and reduce inflammation, while weight management can alleviate pressure on joints for those suffering from arthritis. Techniques such as yoga, acupuncture, and mindfulness meditation can address both the physical and psychological components of chronic pain. Furthermore, incorporating supplements like glucosamine and chondroitin may provide additional relief for joint-related issues, and adopting an anti-inflammatory diet rich in omega-3 fatty acids found in fish can also be beneficial. This holistic approach allows individuals to manage their pain effectively while minimizing their reliance on potentially harmful medications. Medication 2, statins. Next up are statins, among the most commonly prescribed medications globally, especially for managing high cholesterol levels. Statins such as atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor, function by inhibiting a liver enzyme known as HMG-CoA reductase, which is critical for cholesterol production. By lowering levels of low-density lipoprotein, LDL, or bad cholesterol, statins help mitigate the risk of heart attacks, strokes, and other cardiovascular diseases. For individuals at a heightened risk for cardiovascular events, statins can be life-saving. However, their long-term use brings along a set of risks that healthcare professionals are increasingly cautious about. One of the most frequently reported side effects of statins is muscle pain or myopathy. While mild muscle aches may be common, some patients experience severe muscle damage known as rhabdomyolysis. This condition leads to the breakdown of muscle fibers and can have dire consequences, such as kidney damage or even kidney failure in extreme cases. Because of this risk, doctors are vigilant in monitoring patients on statins, particularly those who report muscle-related complaints. Regular checkups and lab tests are essential to catch any signs of muscle breakdown early, ensuring that patients can safely continue their treatment or explore alternatives if necessary. Another significant concern associated with long-term statin use is the potential development of type 2 diabetes. Research has indicated that these medications can raise blood sugar levels, thereby increasing the likelihood of diabetes, especially in individuals predisposed to the condition. This growing concern among medical professionals emphasizes the importance of a balanced approach to cholesterol management, as weighing the benefits of cholesterol reduction against the risks of diabetes can be complex. Additionally, some studies suggest that long-term statin use may be associated with cognitive issues, such as memory loss. Although the evidence in this area is still inconclusive, it highlights the need for ongoing research into the long-term effects of these medications on cognitive health. Given these considerations, many doctors prefer to adopt a more holistic strategy for managing cholesterol rather than relying solely on statins for long-term treatment. Dietary modifications can be significantly effective. For instance, following a heart-healthy diet like the Mediterranean diet can naturally lower cholesterol levels. This approach emphasizes whole foods, including plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats like olive oil and nuts. Additionally, engaging in regular physical activity, such as walking, swimming, or cycling, plays a crucial role in maintaining healthy cholesterol levels. For those interested in natural supplements, options like red yeast rice, which contains naturally occurring statins, and omega-3 fatty acids from fish oil may provide cholesterol-lowering benefits. However, it's vital to consult healthcare providers before starting any new supplement regimen, ensuring it aligns safely with individual health needs. By integrating lifestyle changes and holistic approaches, individuals can effectively manage their cholesterol levels while minimizing the potential risks associated with long-term statin use. Medication 3, Zolpidem, Ambien. Let's take a closer look at Zolpidem, commonly known by its brand name Ambien. Zolpidem is a medication primarily prescribed for the short-term treatment of insomnia, a condition that affects millions of people worldwide. It falls under the category of sedative hypnotics, which are drugs designed to induce sleep by enhancing the effects of a neurotransmitter in the brain called gamma-aminobutyric acid, GABA. By slowing down brain activity, Zolpidem can help individuals fall asleep more quickly and improve overall sleep quality. However, its usage comes with significant considerations, especially regarding the duration of treatment. Physicians are often reluctant to prescribe zolpidem for extended periods due to the risk of developing tolerance, dependence, and various side effects. One of the primary concerns surrounding zolpidem is the potential for dependency. When taken for a prolonged time, individuals may find that they require higher doses to achieve the same sedative effect, a phenomenon known as tolerance. This can lead to physical dependence, where the body adapts to the medication's presence and experiences withdrawal symptoms if the drug is abruptly discontinued. Withdrawal symptoms may include rebound insomnia, which is characterized by an inability to sleep, increased anxiety, irritability, and in severe cases, even seizures. This cycle of dependency and withdrawal highlights the importance of closely monitoring the use of zolpidem, particularly among those with a history of substance abuse or mental health issues. As a result, healthcare providers often recommend tapering the medication rather than stopping it suddenly to mitigate withdrawal effects. Another critical issue with zolpidem is its side effects, particularly the risk of engaging in unusual behaviors while asleep. There have been numerous reports of individuals who, while under the influence of zolpidem, have engaged in sleepwalking, sleep driving, or even sleep eating, all activities performed without any recollection the next day. This presents serious safety concerns, not just for the individual taking the medication but also for others, especially if they operate machinery or drive while in a sedated state. Furthermore, cognitive side effects like memory problems and confusion can be particularly concerning for older adults, who may already be dealing with cognitive decline. For these reasons, physicians are often cautious about prescribing zolpidem long-term and may consider alternative treatments. For those struggling with insomnia yet wishing to avoid long-term reliance on prescription medications, cognitive behavioral therapy for insomnia, CBTI, has emerged as one of the most effective treatments. This therapy involves structured techniques aimed at altering thoughts and behaviors contributing to sleep difficulties. CBTI not only addresses the psychological aspects of insomnia but also equips individuals with practical tools to improve their sleep hygiene. Simple lifestyle adjustments can significantly impact sleep quality, including maintaining a consistent sleep schedule, developing a calming bedtime routine, and limiting screen time before sleep. Additionally, reducing caffeine intake and avoiding heavy meals or alcohol before bedtime can further enhance the ability to fall and stay asleep. Natural sleep aids, such as melatonin supplements and herbal remedies like chamomile or valerian root tea, can provide alternative solutions without the risks associated with prescription sleep medications. Medication 4, SGLT2 inhibitors. SGLT2 inhibitors represent a newer class of medications that have gained popularity for managing type 2 diabetes. Medications such as canagliflozin, Invokana, and dapagliflozin, Farxiga, work by blocking the sodium glucose cotransporter 2, SGLT2, in the kidneys. This action helps to reduce blood sugar levels by promoting the excretion of excess glucose through urine. Not only do these medications help control blood sugar, but they also provide additional cardiovascular and renal benefits, making them a valuable option for patients at risk for heart disease or kidney complications. However, the long-term use of SGLT2 inhibitors is not without risks, prompting healthcare providers to carefully evaluate their appropriateness for individual patients. One of the most common side effects associated with SGLT2 inhibitors is an increased risk of urinary tract infections, UTIs, and genital yeast infections. As these medications promote glucose excretion in the urine, they create an environment that can facilitate the growth of bacteria and yeast. While many of these infections are typically mild and manageable, they can become recurrent for some individuals, leading to discomfort and additional medical interventions. For patients with weakened immune systems or underlying health conditions, UTIs can escalate into more severe infections, such as pyelonephritis, which is a kidney infection that can have serious health implications if left untreated. This potential for recurrent infections is a critical consideration for both patients and healthcare providers when discussing SGLT2 inhibitor therapy. Another significant concern related to SGLT2 inhibitors is the risk of diabetic ketoacidosis, DKA. DKA is a serious condition that arises when the body begins to break down fats at an abnormally high rate, leading to an accumulation of acids known as ketones in the bloodstream. While DKA is predominantly associated with type 1 diabetes, there have been instances of DKA occurring in individuals with type 2 diabetes who are taking SGLT2 inhibitors, sometimes even when their blood sugar levels are within the normal range. DKA can be life-threatening without timely medical intervention, which is why healthcare providers remain vigilant in monitoring patients who are prescribed these medications. Patients should be educated about the signs and symptoms of DKA, such as nausea, vomiting, abdominal pain, and difficulty breathing, to ensure prompt action if these occur. Despite the potential risks, SGLT2 inhibitors offer substantial advantages for people managing type 2 diabetes, particularly those at risk for heart and kidney disease. However, healthcare providers often recommend incorporating additional lifestyle modifications to achieve optimal diabetes management. These lifestyle changes can include adopting a balanced, low-carb diet, engaging in regular physical activity, and consistently monitoring blood glucose levels. In some cases, alternative medications such as metformin or GLP-1 receptor agonists may be more appropriate, depending on individual health profiles and risk factors. Collaboration between patients and healthcare providers is essential in determining the most effective and safe treatment plan for managing diabetes over the long term, with a focus on reducing potential complications. Medication 5. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, have become widely prescribed for managing various acid-related gastrointestinal conditions, including gastroesophageal reflux disease, GERD, and peptic ulcers. Common examples of PPIs include omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. These medications work by effectively reducing the production of stomach acid, which alleviates symptoms like heartburn and prevents damage to the esophagus and stomach lining. The efficacy of PPIs has contributed to their popularity. However, physicians are increasingly cautious about their long-term use due to associated risks and potential adverse effects on overall health. One significant concern with prolonged PPI use is the risk of nutrient deficiencies. Stomach acid is crucial for the absorption of specific vitamins and minerals, including calcium, magnesium, and vitamin B12. Over time, a reduction in stomach acid due to PPI therapy can lead to deficiencies in these essential nutrients, which may increase the risk of developing conditions like osteoporosis, a disorder characterized by weakened bones that are more susceptible to fractures, and anemia, which can manifest as fatigue and various health issues. For older adults, who may already be more vulnerable to nutrient deficiencies, this potential complication is particularly concerning. Routine monitoring of nutrient levels and supplementation may be necessary for patients on long-term PPI therapy to mitigate these risks. Another serious issue linked to long-term PPI use is an increased susceptibility to gastrointestinal infections, particularly Clostridium difficile (C. diff) infections. Stomach acid acts as a natural barrier against harmful bacteria, and a significant reduction in acid levels allows bacteria like C. diff to proliferate. C. diff infections can lead to severe diarrhea, abdominal pain, and potentially life-threatening complications if not promptly addressed. In addition, there is growing evidence suggesting a link between prolonged PPI use and kidney-related issues, with studies indicating an increased risk of chronic kidney disease, CKD, and acute kidney injury in individuals using these medications over extended periods. This association raises concerns about the safety of long-term PPI therapy and emphasizes the importance of regular follow-ups with healthcare providers. If you rely on PPIs for managing acid-related disorders, it's essential to explore alternative strategies for symptom management. Physicians often recommend lifestyle modifications as a primary approach to mitigating GERD and acid reflux symptoms. Simple yet effective changes include avoiding large meals, cutting back on trigger foods such as spicy or fatty items, caffeine, and alcohol, and elevating the head of your bed to reduce nighttime symptoms. In some cases, transitioning to a lower-dose PPI or utilizing H2 blockers like ranitidine, Zantac, may be viable options for long-term management. Additionally, for individuals with peptic ulcers, addressing the underlying causes, such as eradicating Helicobacter pylori infections, may significantly decrease the need for long-term PPI use. Engaging in open discussions with healthcare providers about medication management and lifestyle changes can empower patients to take control of their health and minimize the risks associated with prolonged medication use. Conclusion: medications have transformed modern healthcare, providing essential treatments for a wide range of conditions. However, it's crucial to stay aware of the potential risks that accompany long-term use. While the medications we've discussed can significantly improve quality of life, they can also lead to complications that might overshadow their benefits. Understanding these complexities empowers you to make informed decisions about your treatment options, prioritizing your overall health. Engaging in open dialogue with your healthcare provider is vital for navigating the landscape of medications. Your doctor can offer personalized insights based on your medical history, allowing you to assess the benefits and risks comprehensively. This partnership enhances your understanding of your medications and helps you explore alternative treatments and lifestyle modifications that may provide long-term relief without the complications associated with pharmaceuticals. Remember, managing your health is a journey filled with choices, and medications are just one piece of that puzzle. Incorporating lifestyle changes, such as adopting a balanced diet and engaging in regular physical activity, can play a pivotal role in reducing your dependence on long-term medications. Exploring natural remedies, like herbal supplements or mindfulness practices, can enhance your well-being without the risks of pharmaceuticals. If you found this information helpful, consider taking a proactive step by liking, commenting, and subscribing to our content. This engagement helps us continue providing valuable insights into managing health naturally and effectively. Always consult your healthcare provider before making any changes to your medication or treatment plan. Your health is an ongoing dialogue, and with the right information and support, you can navigate it successfully for a healthier future.